Hello, Dr. Rivero. Welcome to the International Dentist Podcast.
Hi, Dr. Greca. Thank you so much for having me. It's a pleasure being with you here.
And it is long due conversation to talk about your experiences in the US.
That's right. I think you know 99% of it, but it's good to share it with the rest of the people who don't really know what I've done so far.
I will make sure I do my best from the information I know to fill the gaps that I don't know and to hopefully bring up useful information to others because I think your career path has been really unique, interesting, and it shows that with effort and intention, you can really fulfill a dream. And I'm curious, let's start by thinking what were your dreams when you came to the US? Why you came here for the first time?
So, I mean, since I started my career in Venezuela doing, dental school where we actually both attended the same dental school, I had an interest in doing more, going to further training. Like I could see what dental school could give me, but I always knew that I wanted to be able to achieve more than that. So I started considering options into many different specialties. And I started, when we go into our clinical rotations, I started trying out what things I was interested in and what things really didn't really like call my attention. Like I'm sure you're aware, like endodontics or certain areas that I wasn't really excited about. And then I started seeing where I could get the best education possible, what country could offer me the best experience in order to reach my goals. So I considered Europe for a little bit. I actually started learning German for a couple months. Then I gave up and I said, this is not going to work out. So I'll just focus on where I can actually communicate in, relatively easier languages. I had a decent level of English. So I said, I need to go to an English speaking country or a Spanish speaking country. So the US, as you are very well aware, has a very strong foundation on academics, clinical training. There's a lot of like a very long history of very good clinical programs in the US. So that's what attracted me to come to the United States.
And at the beginning, you finished dental school. Do you work for a little bit in Venezuela before coming here?
Yes, I did. I finished dental school in 2008. And since then, I started working as a general dentist and I started doing some work on the side as an assistant or going to oral surgery departments or offices that I was able to be more acquainted with the process of, getting into an oral surgery program or what the life of an oral surgeon was like outside of a university. So I actually started going to the military hospital in Caracas. So I actually got to see and learn a lot from one of my mentors who was there, who is the head of the department of the military hospital, the oral surgery department there. So I got to go to the OR and see a lot of what the hospital based oral surgery was about. So I also worked as a general dentist. And in the meantime, I worked as a general dentist in Venezuela for about 4 years before coming to the US. I was getting ready to come to the US, taking all my national dental boards. I would travel to the US to take the exams while I was studying in Venezuela. As you know, I was very lucky to have a very good support team. I had our very good friend, Laura and Adriana, who were actually by my side throughout the whole time, studying and preparing for these exams. We made a very, very good connection, a very good study group. So that helped me a lot to be able to reside in my home country, study for the exams, and only come to the US to take the exams and then go back. I always said, well, the worst thing that could happen is that, well, if I don't pass, I'll just come back again and take them again. I know people who have actually done the other way around. They have come to the US, and while they're here, they have taken the exams, which for me was a lot more challenging because I wouldn't be able to support myself here by myself. I was able to practice as a dentist in Venezuela and continue, growing my career in Venezuela, while at the same time I could come here and take the exams without needing to live here.
Yeah, that's actually great. I didn't know that you took the boards being in Venezuela, which adds an extra layer of challenge because you're living a normal life or just a general dentist life. And at the same time, you're finding time to study in a different language, which is, it's a big challenge. But having that support group of having maybe partners or friends going through the exam as well. So you guys, you put like study goals together? You kept yourself motivated with like talking to them? How was the process?
So the good thing is that our personalities are very similar, and we all have strengths and weaknesses, so we kind of complemented each other. I tend to be a little more disciplined. Like I like to follow guidelines and say like, we're gonna follow these rules. We're gonna, break these down into um, different parts, and we're gonna assign, a specific chapter to one person. That person's gonna come in and explain it to the rest of us. Um, but at the moment of actually sitting down and studying, I would get very distracted. So having Laura and Adriana, my two peers from Venezuela, um, keep me motivated and keeping me engaged, asking me questions, saying, "Well, did you know this? Did you know that? Let's do some practice questions." So that kept me, kind of like focused and allowed me to not be distracted so easily, which I think is very common when you're studying by yourself. You're sitting at home, you're supposed to read 400 pages of very dense material that's not easy to digest. Nobody's going to say like, "Oh, I love studying, biochemistry and histology." I'm sure there are exciting topics there. However, I find it really hard to find somebody who's going to say, "Well, I just love sitting down and reading for 8 hours, page after page." So that allowed me to be able to you know, be more successful because they would help me out the same way that, I would try to help them out in certain areas that they had difficulties with.
Yeah, that's super important. And as you mentioned, just having that opportunity of taking it when you're home. So it didn't require it. It is a financial commitment traveling, but it's never as much as moving to a place just to study.
Correct, correct, 100%. So being in Venezuela actually allowed me to tailor my schedule. I could decide if I wanted to work 3 days a week or 4 days a week or have shorter days when I needed to study or, get together with my peers to study. So I could also go to do my oral surgery, um, observer sheets and, be more involved with certain things that I was still in the process of exploring and, getting to know where I wanted to go next. So that was, perfect. Worked out very well.
Absolutely. I'm curious, did you ever felt tempted like being in the military hospital and knowing what the oral surgery programs were in Venezuela? Did you ever felt tempted to just drop the idea of the US and apply in Venezuela?
I did actually. I was in an internship in oral surgery in one of the hospitals in Venezuela, a very underserved area. Mm, I was there for about 5 months, and I realized I was there. I really enjoyed the experience. It's a very good program. There were many things to learn, and the scope of things that you could do there was amazing. However, the education that I would be able to obtain there wouldn't be comparable to what I would be able to obtain if I came to the US. There were many limitations due to the country and inability to access resources. Patients were not necessarily in the best financial position to support the type of treatment that was recommended. So um, that's when I realized and I said, I don't think Venezuela is going to be the best place for me. Taking into consideration that I had already done a decent amount of studying and I had taken my national dental boards to come to the US, I had already put in a lot of effort to come into the US. So I didn't want to divert to just staying in Venezuela because it was kind of like the easier choice for me. There were many things that, contributed to me making that decision to come to the US later on. But at the time, for a little bit, I said, I'm going to stay in Venezuela. I'm going to train in Venezuela and I'm just going to stay here. Certain things kind of like pushed me and said, that's not the right choice. You need to move on.
Yeah. And then after those 4 years, that you start feeling a little bit comfortable, maybe like knowing what the system looks like, maybe you're tempted for these other options, but you had your national boards already. So I guess you were ready for applying. What made you finally move, or how did that happen?
So since I was in dental school, I mean, this goes like way back. I'm going to start by saying when I first learned English 1,000 years ago, and I was like 17, I went to London. I spent like 6 months there, and I really enjoyed the experience of being around different people, learning from different cultures, and being exposed to new stuff. I was always curious about new things, and I was very excited about learning how things somewhere else work. Um, I went through dental school, and I always had that little curiosity, saying like, "Well, I understand what we have in Venezuela. However, I knew that there was a lot more outside of Venezuela." So I always had the curiosity to, you know, go on the internet and see what are people doing in other countries. So going to conferences, we always had as dental students, it's very common in Venezuela, it's very common practice that dental students attend these very, very large meetings. So I was able to see what other Venezuelans were doing outside of Venezuela, where they were training, what they were bringing back to our country, and the kind of experiences that were available in other places. So that kind of like, made me consider looking into other options and seeing what was outside.
Yeah. And then what made you finally, do you start the application process from Venezuela, or you move before applying?
Good question. So I started, since I was in Venezuela, I started looking into those options, as I was mentioning before, and seeing what it would take for me to be able to apply to this program. However, it just looked impossible. When I went into, let's say, I was very interested in doing oral surgery since I was in dental school. And I started looking at different options and seeing, well, what do I need to do if I wanted to go into an oral maxillofacial surgery program in Europe? So I understood that that was not an option for me because I needed to basically go into medical school all over and basically be a medical doctor first, and then go into an oral maxillofacial surgery training program, which is what I was interested in. In many places of the world, there is a difference. There are oral surgery programs and there are oral maxillofacial surgery programs. So in order to do that maxillofacial part in Europe, you're required to have an MD. So I started looking at other
If
options.
you don't mind explaining the difference between an oral surgeon and an maxillofacial surgeon.
So in places like Venezuela and Europe, there's the oral surgeons are mostly dedicated to intraoral procedures, not necessarily, but mostly. There is a gray area where oral surgeons and maxillofacial surgeons basically do the same thing. However, maxillofacial surgeons tend to be a lot more hospital based. They do a lot more medical procedures. There's trauma, there's surgery regarding oncologic procedures, reconstruction. It tends to be a little bit more broad and more hospital based. Surgeries tend to be a lot more extensive than oral surgery. Oral surgery is usually based in a dental office, and there's a lot more dental the other procedures, implant dentistry, wisdom teeth surgery, pathology, intraoral pathology. However, the big reconstruction cases for large lesions tend to be done by maxillofacial surgeons with the help of many other specialties.
That's what you realized you liked. You like maxillofacial procedures the most.
Right. I was very attracted to it because it looked exciting. I saw it and I said, well, I see myself doing something like this. It's exciting. I'm drawn into it. So I started, looking into what the options were. And I said, well, in order to do something like this, I need to, number one, build up my resume and start being exposed to this and really see if I want to do it. Because I don't want to end up having a career that, when you're in the middle of it, you say like, I'm not sure. This isn't really what I wanted to do.
Yeah.
Excuse me. So from Venezuela, I started figuring out the process for applications and trying to basically check the boxes and seeing, well, what do I need? I need to have, a certain level of English. Okay, try to focus on improving your English. I need to have my national dental boards. Well, what do I need to do? Initially, when I learned that in order to be able to practice or to come to the US for these type of programs, I had to take those exams. I said, kind of like in a very naive way, I said, well, one of these days when I go for a vacation, I can just stop by and take the test. Well, that was not exactly how it works. Um, when I started seeing what the actual test was like, I said, there's no way I'm actually going to need to sit down for months to study for these. There's, as I'm sure you're aware, the NBDE Part 1, which I think is now combined. I don't know if it happened this year, but when I took them, it used to be, there was NBDE, National Dental Board Examination Part 1, was mostly basic sciences. It's very, hard to digest material, biochemistry, pathology, physiology. So you actually have to sit down. It's very detail oriented. You need to know the material very well. Then I said, well, if I really want to go to the US, this is one of the things that I have to do first. Whether I like it or not, I'm going to have to do it. So I said, suck it up, sit down, try to study, and see what happens, So then after that, after trying to figure out what the options were, I finished dental school and I took my first dental board, and immediately I said, well, now I'm eligible. I can apply to these programs. But I was still in Venezuela. I hadn't had a lot of exposure to programs in the US. I didn't know, excuse me, a lot of people who had actually been in these programs in the US. Most of the people that I had met had been in these programs a while ago. So 20, 30 years ago, the information, the requirements, everything had changed. As you're well aware, after September 11th of 2001, things changed dramatically. In order to be able to be accepted into programs, things got a lot more strict. So the people who were kind of like advising me on how I was going to be able to get into these programs said, well, this is when I was there. These were the conditions. It's not like that anymore. You basically have to jump through a lot more hoops now, and things have gotten a lot more difficult. So
I'm curious, where were some of those hoops then have to jump to it?
So basically, in order to be accepted into many programs, a lot of programs started requiring that you became or that you were a U.S. citizen, which of course I was not. Started requiring that you have gone into a U.S. dental school. So in order to get in, if you wanted to do some of these programs, you needed to basically go back to and do dental school all over. There are some programs, that had options for international dentists doing like a 2, 3, 4 year kind of like advanced standing program in order to be able to get your dental degree from the US. So all that research went into place when I was in Venezuela. And, I started looking at options and seeing, well, what does it take for me to go to the US and, follow this path and basically get to my end goal, which was training in the US and getting the best education I could possibly get. And initially, I had the idea of coming back to Venezuela and practicing in Venezuela and teaching in Venezuela, and like basically growing in Venezuela, because at the time, Venezuela was still survivable. You could still grow in Venezuela. There was a lot of opportunity that you could have if you had this type of training, which I have friends who are still in Venezuela and they're doing great, very intelligent, very smart, very successful. However, that's not the norm. Not everyone is able to be successful, regardless of what type of training you have. So, doing all this, extensive research, I started seeing what I needed to do to apply. I started applying from Venezuela without knowing exactly what it took to be here. And then I realized, well, nobody's calling me for interviews. What's happening? So I didn't even know if it was a good thing or a bad thing. I was like, well, they're not calling me for interviews. Does that mean that, they like me or they like my application enough to not call me and they're going to call me later? Or I don't know. So I applied. I think the first time I applied was like 2009, I believe, right after I took my first national dental board. And I saw that, of course, I didn't match. I didn't know anybody here. And then I said, like, well, I'm obviously doing something wrong. I started talking to people who were here. One of those people was Dr. Gomez at Jackson Memorial Hospital in Miami, who was, very, very helpful. He kind of said, well, from Venezuela, you're not going to do much. You need to come here, see what it is like, and try to meet people, try to see, what people actually recommend and what they tell you. Try to talk to people who are in your same position. So I came and I started doing some observerships. I went to the University of Miami in Miami for about 3 months. I was there. And, I started getting very involved in the oral surgery program and learning what it actually took to, to make it. I talked to my, counterparts, US graduates who were going through the process. And I realized that even though we were kind of at the same level, on paper, they had a lot of things that I didn't have. So I said, well, I need to be able
Simple.
certain things like research that I had some research in Venezuela, which didn't really count here. So all the publications I had made a couple publications in Venezuela that were not basically counted in the US because they were not peer-reviewed journals that were known by people here. Letters of recommendations from people who were living and practicing in the US. So I didn't have anyone who could basically vouch for me and say, well, this person is somebody who's going to do a good job as a resident, is somebody who you should consider for residency. I had all my letters of recommendation were from people in Venezuela. So that is something that I realized. And I said, well, I need to be able to get to know people here. And I need to have them know me and realize that I'm a good candidate and I'm really interested in doing it. So I started, working up on that process and eventually decided to apply for oral surgery programs as well as for, general dentistry programs. Because I said, getting into one of these oral surgery programs is extremely competitive. They had basically 2 positions for 300, 500 applicants. And being a non-US citizen, and not having been to dental school in the US, not having a US dental degree, definitely put me at a disadvantage because those were the first two things. Regardless of my background and all the work I had done to get into an oral surgery program, those two things basically were blocking the road. So I said, well, I can definitely start. I can find my path through, a different way. And those different ways were many. As you have explained here in your podcast a couple times, a couple times. One of them was going back to dental school, which I mentioned before. I did not want to go back to dental school. I felt that I was going backwards. I said, well, going back to dental school is definitely going to help me get the paper and be able to achieve this goal. However, I'm going to be miserable for 2, 3, 4 years because I do not want to go backwards.
Also,
I want
it's a big financial commitment too, because then
100%, 100%. So when I realized that these were basically the two things that were blocking me from getting there, I said, well, even if I'm miserable for these couple years or 3 years, however, that's going to be, I'm willing to do it. I'm willing to consider going back to dental school to, be able to show that I'm capable and I'm comparable to my US peers. So I started doing my research. The fact that I didn't have a financial sponsor in the US didn't allow me to get loans. So even if I was accepted into a dental school for these advanced standing programs, I would not be able to pay for them because I didn't have the cash sitting at home. I didn't have $400,000 sitting in a bank account to pay for dental school, and I wouldn't be able to obtain loans. So that was out of the question. I said, this is definitely not for me unless I win the Powerball or something, which I'm still trying.
remember your
So,
options if you do.
so I said, well, what are the other options? One of the options was just going straight into an oral surgery program,
Mm.
which is possible, but very difficult. And the other options was going through the path of doing another residency and going into another program, whatever kind of program it was. So I did my research and I learned that general dentistry programs would allow me to obtain a dental license, an unrestricted dental license in many states in the US. And those programs would offer a stipend. I would be getting paid while I was doing this residency program. So I said, well, that's a great option. So if I'm able to get into one of these programs, I can actually get closer to my goal and
Without
be
blank in the process, right?
without going back. Correct. So it allowed me to move forward, not exactly what I had in mind at the beginning, but it was a very good option. It would allow me to explore other things. So I said, let's go ahead. I put my applications in for the oral surgery programs. I put my application in for, I think, one AGD program. And that AGD program, I'm lucky enough that they called me for an interview and thank God I was accepted. So that, kind of like opened the doors of the US education system for me. So that was my path. Everyone has, different opportunities that open up. So for me, that was, the door that opened, and I'm very lucky to have been able to do it. So I started through an AGD program for 2 years at the University of Connecticut.
Yeah, and that's actually one of the few programs we had the program director in the podcast as well in this season. And then he talked a little bit about the program, but it's interesting because that's one of the few programs that offers a stipend for international, like for non-American trained dentists, which I think it's a very great opportunity when you don't have, as you said, $400,000 sitting under your bed, or you don't want to break the bank of getting this.
Correct. So the program at the University of Connecticut is a very, very large program. It's very well known in the international dentist community. There's a lot of people from Canada who come to do this program. mostly for the experience of, training in the US and having the US experience. And there's a lot of um, dentists from Venezuela, from Peru, from Argentina, Guatemala. So people who want to come here and train, a lot of them go back to their own country. Some of them stay here and do other programs. Some people have gotten into implant dentistry, into endodontics, prosthodontics, into many different areas, but it's a good pathway to come in and see, what it is like and be exposed, work in a, full university, a university that has all the dental specialties except for the newly recognized ones in 2019 and 20. I think one of them was recognized in 2020. Um, so it gives you an opportunity to be exposed to a lot of things that we don't really do in our countries, and see what you like, see what you don't like, and expand your knowledge, like open your mind, see what the opportunities are, and understand that maybe you have a plan A, but there are, many, many, many other different options that might be as good or even better than the option that you had initially in mind.
I think that advice that you received from that doctor in Miami about just coming here and you will know much more of your options. And I'm curious, once you got to Connecticut, 2 years go very fast, by the way. Like you feel like it's gonna be long, but when you realize you already need to start planning for your next thing. Did you feel that in those 3 years you changed your mind into what you wanted to do, or you opened your mind to other things, or you still had in mind oral surgery?
I still had oral surgery in mind. However, I had, the openness to consider other things. And I realized that the mindset that I was coming in initially in 2012 when I started my AGD was not 100% accurate. My ideas of what I wanted to do started to change. I started, when I was at the University of Connecticut program, I was able to rotate and be very involved with the oral surgery program and see what they were doing. I was actually taking call at the hospital as a general dentistry resident. I was receiving the patients that were coming into the emergency room and, kind of like being very exposed to the hospital environment. And I started realizing that I wasn't necessarily very interested in, spending 12 hours standing in the operating room doing a case. I said, well, this is very cool. However, I don't see myself doing this for the rest of my life. I'm much more interested in doing something that's office based, um, not necessarily as invasive, and being able to balance, a quality of life with work. So
Did you notice that oral surgeons here or maxillofacial surgeons here did not have that quality of life that much? And maybe that was what drew you to different
so
things?
I knew that going through the residency program would be a very difficult, and it would take 99% of my time. However, you know, taking into consideration that there were many other options that would allow you to have a better quality of life at the same time as you were getting a very good education and training. Um, Unfortunately, a lot of these programs have a lot of emphasis on things that most of the graduates don't do when they finish. So some programs are very heavy on orthodontic surgery. Some programs are very heavy on um, cancer surgery, reconstruction. So out of the graduates of an oral surgery program in the US with those characteristics, very few of the graduates actually end up doing those type of procedures. Most of them end up, diverting to doing more dental velar surgery, implant surgery, being in a dental office, doing some anesthesia, some, implant dentistry, and combining those procedures instead of, you end up spending a lot of time learning something that it's not necessarily what you're going to be doing when you finish. So I realized, well, why would I go through all this training if I'm not necessarily going to be using this? And I don't see myself, doing for my whole life all these type of very long and extensive procedures.
Yeah. So I think what you mentioned too is the fact that yes, you can do that for a couple of years, and I guess residency or all maxillofacial residency in the U.S. is 4 years. So you could be okay committing maybe 4 years of your time with what we call a so-called a miserable resident life.
Yeah,
But you don't want to have a miserable professional life or a professional life that depends, especially if you realize that you didn't want to have the hospital base, because when you describe those procedures, those major procedures basically require you that you stay connected with the hospital-based setting always.
correct. Yes. So there are 4 and 6 year residency programs in oral surgery in the U.S. The 6 year track basically has residents go through medical school. You have to go to 2.5 to 3 years of medical school, and you end up receiving a medical degree, which, in my personal opinion, would mean that I am going to be using all that education. I am going to be, you know, doing things that are a little more than just placing implants and taking wisdom teeth out. So those are the things that I said, well, I don't see the point of necessarily going through all this training to be able to, you know, do implant surgery or to do wisdom teeth or to do minor dental the other procedures. I said, this is not necessarily what I want. So I started, opening up my mind, looking at other things. When I was at the University of Connecticut, I also had the opportunity of meeting and working with a very, very intelligent, very respected dental anesthesiologist in Connecticut who actually came to the clinic, and he would do the sedation for my patients, for my general dentistry patients. And I initially didn't even know that he was a dentist. I thought he was an MD anesthesiologist. And when we started, talking, and he told me he had gone to the UConn dental school, and I was like, dental school? You're a dentist? He's like, yeah, I'm a dentist. So back in the day, in the 50s or 60s, dentists were able to do a 1 year residency or 2 year residency in anesthesiology, just going into the operating room, training alongside our medical colleagues. And when they were done, they would do the anesthesia / sedation for dentistry. So I started, thinking about it, and I said, well, this is actually a very interesting field. This is something that I would love to do. I know that as oral surgeons, a lot of oral surgeons actually do their own sedation. So I was always interested in the anesthesia aspect um, of dentistry, but I never really applied to anesthesia because anesthesia was what's considered in the US a phase 1 match. After you apply for residency programs, there are 2 processes of assigning people to programs. The first phase is phase 1 match, which, don't quote me on this, but I think it includes like pediatric dentistry, anesthesia, maybe
The
oral medicine, and maybe ortho. I don't remember quite well, but it's phase 1. If you are assigned to a program in that phase 1 match, you're not able to participate in the phase 2 match. Phase 2 match has AGD, Advanced Education General Dentistry, GPR, oral surgery. So those were the programs that I was a lot more interested in. And I always said, well, if I apply for anesthesia and I get in, I'm never going to be able to know if I would be able to get into the AGD or the oral surgery programs.
I see.
So even though I liked anesthesia and I actually looked at the programs a while back, I said, well, I can't apply because it would, interfere with my application to the other program. So I never did it.
And what made you change at some point? Because let's just fast forward a little bit. You finished the AHD, and when did you decide that you wanted to take that path of anesthesiology?
I came to New York to do an oral surgery internship at Jacobi Medical Center in the Bronx, the only level 1 trauma center in a very large area of the Bronx that they were offering positions for people who were interested in doing oral surgery to come in for 1 year and basically work as an oral surgery resident for 1 year. Get the experience, get in, see how you feel, see if you like it, learn a lot, and then, you don't have a commitment of staying there for 4, 5, 6 years. You can be there 1 year and then go back and practice as a general dentist if you want, with a very, very strong experience in oral surgery. So I came to New York, and I had a lot of issues with actually starting that program. I actually started 4 months late because of some visa issues that I had with, my home country of Venezuela, and needing documents from there that I could, never get. The hospital was actually kind enough to allow me to start late. They waited for me these 4 months that it actually took me to get my visa paperwork in place and, start. So even though I was there, I was supposed to start on July 1st, like most residencies, I actually started in November. Um, so during the whole time I was there, but I wasn't able to practice dentistry because technically I wasn't allowed. So I ended up starting in November and, getting all the experience of going through an oral surgery program, being on call, getting calls in the middle of the night at 3 a.m., people coming in with, face lacerations, abscesses, mandible fractures, being in the operating room, doing a lot of dental alveolar surgery, taking out a lot of wisdom teeth, and also doing some anesthesia. Um, we had oral surgeons supervising the procedures, and we were sedating patients and doing the procedures. So when I actually got to do that, I said, this is pretty cool. Like, I like doing this. I don't necessarily need to be 12 hours standing in the operating room for a challenging case. Um, I really enjoy this experience. I think it provides a lot of very good service for patients who are coming in pain, stressed out, anxious, fearful. And I said, well, this is something that, really helps people. Myself as a kid, I was a horrible patient. As when I was going to the dentist, I would scream, kick, try to run away from there. So I said, this is a very, very good field. Mm. And then eventually I ended up going to a rotation in anesthesia while I was in oral surgery. I went 2 weeks to a rotation in anesthesia and got to know the dental anesthesiology residents. And, I talked to them and I said, well, what is it that you guys really do when you're done? What are the options? And, I started seeing what they were doing in the operating rooms. And initially in my head, I said, well, dental anesthesiologists are just kind of like, giving a little bit of nitrous oxide, kind of like mildly sedating patients, and that's it. When I actually went into the operating room, I saw, dental anesthesiologists functioning as a general anesthesiologist, doing intubations, the full scope of anesthesia, doing everything that, our medical colleagues were doing, they were doing. So, that actually kind of like opened up my mind, got me, motivated, and I said, well, this is something that I could definitely do. However, I'm very stubborn. You already know me. So I was still with my idea of kind of like, well, I set up a goal already, and I shouldn't be distracted from it. I'm going to, continue pushing for this. But then I had it in the back of my head. I went to a couple interviews for oral surgery programs. And then, of course, I started facing the same situation. Well, even though I had finished an AGD in the US, I didn't have a US dental degree. I had a certificate in an advanced training program. And I was still not a US citizen or a permanent resident. So those things were still blocking my way. And I said, well, I have already done 2 years of AGD, 1 year of an oral surgery internship. Am I willing to continue, you know, going into more internships or spending more time as I get older through this process? And, will I get in? Probably yes, but I'm not willing to sacrifice 3, 4, 5 more years of my life to achieve this goal. I realized that there was a lot more to see. There was a lot more to do. I could be a lot more useful to society doing other things than, by focusing on my, kind of like, narrow minded goal that I always had. And I said, like, well, I'm actually going to do this and I have to do this. I said, kind of like open up your options, see what else is there. And, what can you do to offer, your potential to other people? And I saw that in dentistry, there's a very high demand for sedation, for anesthesia. There's a lot of patients who avoid going to the dentist because they're afraid of the sound of the drill. They're afraid the dentist is going to hurt them. They have had, bad experiences going to the dentist, and I could help them by doing this. And,
Oh, that actually dentists that go on dental anesthesiologists, the profession is quite small, right?
it's very, very small. There are currently, I believe, 9 or 10 programs in North America, and each program has about 2 to 4 residents. 5 of those programs are actually in New York. Okay, so in March of 2019, anesthesiology actually became a recognized specialty by the American Dental Association, which took many, many years of efforts from a lot of people trying to get it to that level, to trying to get it to be a recognized specialty in dentistry. It is a, very well recognized specialty in medicine. However, in dentistry, it was kind of like, oh, it's kind of like a side thing that we sometimes do. Dentists have needed to do anesthesia for their patients since, the beginning of dentistry. The first people who were actually experimenting with anesthesia were dentists. These dentists were, trying different things to be able to alleviate the pain of the patients. So in don't quote me on this, but like in the 1800s, 1840s, 1850s, it was actually a couple dentists in Boston and Connecticut who were at the forefront of developing what we now know as anesthesia. Horace Wells in Connecticut and William Morton in Massachusetts, in Boston, they actually started experimenting with nitrous oxide and gave the first demonstration at the Ether Dome at Harvard, which, it's still known as the Ether Dome, for a procedure. I think it was like a neck tumor that was removed. One of these dentists actually did the anesthesia, provided, painless anesthesia for a procedure. And that is what kind of like, created this boom of, being able to undergo surgery without actually having to scream through the whole process, and, being excruciating pain.
Yeah, a transformation on the profession at many levels.
100%, 100%. Yes. We understand dentistry and we, love the advances that we have, all the cool gadgets and technology and techniques that we have nowadays. So having anesthesia as a recognized sense of specialty, of course, allows dentistry to be able to provide the best level of care for our patients, to be able to help, other dentists to provide safe care to their patients. And, as I was mentioning before, just all the advances that we nowadays have in dentistry, all the cool procedures and gadgets and technology that we have nowadays wouldn't be possible without local anesthesia, without sedation, and, without being able to do this as a painless procedure. We wouldn't actually have a job nowadays, if it wasn't for anesthesia.
Even if we were doing, imagine we were offering guided surgery and all that without anesthesia. Still will get no patients.
I don't think you would be able to get a lot of people coming in willing to do.
I'm sure not. But I'm curious, for those that don't know, what it represents for you as dental anesthesiologist that the specialty is now recognized. Because when you started the program, it was not. And it actually converted afterwards. Did it make any difference in your practice?
It did not make any difference in my practice. It did not make any difference personally for me. However, it's something that I'm well aware of because of my previous generations and their fight, their struggle to get it recognized, to make it known that this exists and giving it the importance it deserves. In medicine, it's very, very clear. There's no question about, having an anesthesiologist coming into your surgery, because you wouldn't sit down for your surgery if the anesthesiologist wasn't there. So in dentistry, there has been a practice model doing the operation, doing the surgery, and the anesthesia at the same time, which has proven to be very successful, very safe. However, it's not the only model. And in medicine, it has started to shift towards separating the anesthesiologist from the surgeon. So in medicine, very, very, very few procedures are done by the physician who's actually doing the procedure is actually administering the anesthesia at the same time. One of the few examples is endoscopies. Some endoscopies are done with, the gastroenterologist is actually administering some very mild level of sedation. However, if you really want to do, a more extensive, procedure, or if the gastroenterologist says, well, I really need to focus on this procedure, I can't be administering anesthesia and, watching the vital signs and, calculating the doses and making sure these patients actually comfortable and safe. I'm going to need to have somebody else, working all this out. It actually takes a lot of effort, and it takes a lot of concentration to do the anesthesia on its own and to do the procedure on its own.
And it's a big responsibility as well for both procedures.
So is it possible to do both things at the same time safely? I think it is possible. However, we try to have our motto as safety first. When we start saying, well, is this the safest way to do it? Probably not. So there's a lot of movement to try to get a lot more dental anesthesiologists or anesthesia providers, whatever type of anesthesia providers are considered, to dental offices when it's not really feasible for the practitioner, for the surgeon, the dentist, to do both things at the same time.
I see. And I'm curious what your lifestyle as a dental. I'm going to fast forward a little bit. You finished your dental anesthesiology program, and now you're ready for license. And I guess just to connect it back to the question of once it becomes a recognized specialty for international dentists, that might be a pathway through licensure, correct?
Yes. So to my knowledge, there's only one state, which is the great state of Texas, where I am right now, that allows foreign trained dentists to practice if they have done an ADA recognized specialty, which anesthesia was not a recognized specialty. When I finished my program in 2018, I considered coming to Texas because I have family in Texas. I considered coming to Texas to practice, but I couldn't come here. I wouldn't be able to get a license because anesthesia wasn't recognized back then. Now that it is recognized because of the laws in Texas, I would be able to obtain a dental license in Texas. So that is the only thing that I see would impact me directly right now, which is positive from having the ADA recognized as a specialty.
Yeah. And now that you decided to finish and stay in New York or New York area, what is your daily practice? What does the life of a dental anesthesiology looks like?
So it's very hectic in a way because I am traveling a lot. I go to different dental offices. I bring all my equipment and monitors, medications. I bring everything with me and, kind of like set up an operating room in a dental office. So I need to normally leave very early. There's a lot of, traveling, as I mentioned before. I need to load up all my equipment. I have an SUV, so I have plenty of room, but I need to bring everything with me. And when I get home, because of safety, I can't leave any of that equipment inside my vehicle or any of the medications inside the vehicle. I need to carry everything with me. So I'm loading and unloading every day. I load up my car. I get to a dental office. I set everything up. I have to inspect that, we have enough oxygen, that we have the right suction, that we have enough staff, that we have all the equipment that we need to actually be able to do the anesthesia or sedation safely in the dental office. I'm also working at St. Barnabas Hospital in the Bronx as an attending. So I'm there once a week, every Wednesday. So I go there, and when I'm at the hospital, I don't need to bring all my equipment because the hospital is already fully stocked. And I work with the dental anesthesiology residents. I work with the oral surgery residents, pediatric dentistry residents, and basically supervise the dental anesthesia residents when they're providing the anesthesia for dental patients.
Okay, that's nice. That's a very different pathway and very unique. And I guess in a way, you just found it through being exposed to it. I think it's hard, especially for us in Venezuela, where first it's not a specialty. We are very aware that in medicine, I mean, we all know the anesthesiologists in medicine, but we don't even have dental anesthesiologists in Venezuela, to my understanding. You can correct me if I'm wrong. But now that you have discovered this path and looking back in time, maybe thinking to that Jose that was in Caracas studying for national board and thinking on coming to the US with all these dreams and ideas. If you could give your young self or somebody now in that position a piece of advice when thinking on coming to the US, what would that be?
So, again, as I mentioned, I tend to be a very stubborn person. Once I set my mind on something, um, I always push to actually get it. And, you'll see that I'm not really the person who sits around and wait for things to just land on my lap. Like I go and I fight for it. I'm able to, you know, adapt to different situations and, be resilient. If I could go back, I would probably, it's a hard question. I would probably say keep your eyes open for opportunities that may be lying around. And because you're not really always open to see them, you might be missing them. So it's important to keep your eyes open. It's important to consider all options, um, to stay committed, never give up. If you have a goal, keep pushing for it. You may have a plan A, but there are so many other letters in the alphabet that might be as good or even better. So, coming from Venezuela, where anesthesia is not a recognized specialty, and not really knowing, not being familiar with anesthesia, it wasn't something that I was really considering. I knew that in my plan of doing oral surgery, anesthesia was kind of like a part of it. I knew that it was included in the training if I would do oral surgery. Um, but I never really knew exactly what it would take and, the scope of practice that was available. So if I had known earlier on, I would probably have started applying for this much earlier. And, I don't regret anything. I think it has been an excellent experience, and I wouldn't have gotten to the point where I am without the experiences that I had. So I had to, go through 6 years of training, of residency after dental school to actually be where I am. So I enjoyed the whole time, and I think every single day had something positive to add to my life.
Absolutely. I love that message because it's how we look at things. And I think the key message of all of this, and in this, we are very similar. And we always talk about we like to be disciplined, we like to have a plan. And I think it's hard when you're by nature stubborn. I am stubborn myself too, to give yourself that mental space to change your mind. And I agree, it's okay to change your mind because there is always a little voice inside of you, like, but you should be doing this, which is what you were always wanted to do. And just be flexible and accepting that the path might be just different to what you envision. And that's not necessarily better or worse. Actually, sometimes might be even what will suit you better. And opportunities
100%.
you will attract the opportunities that I think they're going to be best suited for you.
100%. So taking the how is it they say taking the road less traveled or the path less traveled sometimes is the best option.
It's a blessing. Well, thank you so much for your time, Jose. I did learn a few things from you that I didn't know, surprisingly.
Like one or two, maybe. Thanks so much for having me, Gabby. I appreciate it.
I think it was super nice. And if people want to connect with you, is it social media the best way of reaching out if they have questions?
So the easiest way is going to be through Instagram. You can find me at NY, that's New York, sedation, at NY sedation on Instagram. Or you can email me at metropolitansedation@gmail.com with any questions. And, I'm more than happy to answer as much as, I can help.
Absolutely. I'll make sure to leave all that contact information in the description box. But thank you so much again for your time.
Thank you so much, Gabby.